Good evening and welcome to this edition of Tok Piksa. Despite the fact that both men and women can develop cancers, here in Papua New Guinea, cancer is usually associated with our women folk more than with our men. This week, the PNG Cancer Foundation hosted a workshop focused on men's cancers, and this month of November has as its focus the ramping up of awareness around cancers in men. The foundation invited Professor Ian Olver, cancer researcher, bioethicist and medical oncologist. He is also a member of the Advisory Council for Cancer Australia. Professor Olver facilitated the workshop this week and joins us tonight on Tok Piksa, along with CEO of the PNG Cancer Foundation, Dadi Toka Jr. Gentlemen, thank you for your time and welcome to the program.
Thank you. Thank you, Neville.
So November, or Movember, as we could call it now, is a focus on men's cancers. What's been happening with that?
I guess from the foundation perspective, our focus throughout the year has been on awareness and education. We do a lot of that work around women's cancers, and of course, when you look at mouth cancer, that involves men as well. The month of November is I guess, an area that hasn't been explored yet. Due to the fact that we just didn't have enough information around it, especially statistics with men's cancer in Papua New Guinea. But this year we decided to move forward with it because we needed to move forward, take that first step forward at some stage. And this year we've decided to move forward with that campaign and start doing awareness and education on men's cancer. Of course, the best way to start off such a campaign is to host a workshop where we can be guided in the right direction clinically. We're fortunate enough to be working alongside Professor Ian Olver, who's been very instrumental in the early days of the setting up of the Cancer Foundation. So we're very, very lucky to have him on board, and of course he's come to Port Moresby again. He's not new to this country. He's visited on numerous occasions, so it's great to have him on board and to facilitate the first ever men's cancer awareness workshop we hosted yesterday. And
Professor Olver, how did the workshop go?
Look, I was very pleased, given that it was the first one. We had 150 there. There were about 15 women and 135 men. So to have that sort of response showed that there's a great interest there in learning. And we pitched it about prevention of cancers because we wanted to put out messages that about a third of cancers could be prevented just by lifestyle measures that are modifiable. And so if we can tell men what they are, then they have a choice to modify the way they live and reduce their cancer risk.
And traditionally, in your experience, are men open to making those changes?
Well, look, men have traditionally been a tougher audience than women. That's why I was pleased to see women there, because one of the ways of convincing men is to get women to do it. But overall, if you've got a risk of cancer, say you've got a family history of cancer, then you can't change that. So you want to know what you can do that you can actually modify. And so men are responsive to the message, and what we want to make sure is that they actually know what they can do, and then the next step is whether they choose to do it, and that'll depend on a whole lot of things, like how much they're worried about cancer in the first place.
And the level of feedback from the participants of the workshop?
Well, so far it appears to have been very positive. We've had stories of people going back to their offices and workplace and telling all their friends about the sort of things they can do. So I think that sort of story just shows how positive they've taken the message. We're not here to preach, we're just here to give information. And so if you don't know, for example, that being overweight or drinking too much alcohol, which have always been associated with heart disease and diabetes, if you don't know that they're actually associated with common cancers as well, then you can't do anything about modifying that. But if you do know, then it becomes an option for you.
And what would be the main cancers that would affect men in Papua New Guinea specifically?
Well, we don't have good records in Papua New Guinea. Obviously, prostate cancer is a big one in men anyway. We're worried in Papua New Guinea about lung cancer because of the high smoking rates. We've got mouth cancer because of betel nut use. And so we want to focus on those, but bowel cancer is usually a big one in both men and women, and all of those have factors that you can modify. So if we start off not from the cancer but from the lifestyle changes, it'll affect a whole range of cancers that are common in men.
And you work with the foundation, some experience from the foundation, Dadi. How have men approached the issue of cancer traditionally here in PNG or in the local settings?
Yeah, we do conduct programs throughout the throughout the countries. For example, just recently we're in Kimbe to do a comprehensive cancer awareness program. Okay, so when we do our cancer programs in the provinces, we do free screening, visual inspection for breast and mouth cancer. Okay, and then we do a workshop on cervical cancer. Recently in Kimbe, the cervical cancer workshop had, out of the 400 people that were there, over 100 of them were males. So, once again, that role can be reversed where the males want to go and sit in these workshops where they can go into discussions and talk about, oh, hang on, this, I noticed this with my wife or with my, daughter or sister. Maybe I need to take this information back. And this is where the brochures are very important, because then they take something back. They get educated themselves, but if they are confused at how they can disseminate that information, the brochure is very important. So it's imperative we get the appropriate people that approve the content, whether it's in English Pidgin or English Pidgin or Motu. It just needs to follow that process, the appropriate process. So we get the message all the way through from where we hold the program all the way to their homes.
At any stage of this awareness, do we look at meeting or identifying male survivors of cancer? And because they would be a powerful role model.
Of course, I mean, we, the workshop we held yesterday, it's the first of its kind, and towards the end, I did mention to the audience that we need feedback because we want to improve from here. If it didn't work like this, let's try this next time. And I guess funding-wise, there are supporters that will put money into such a program. But we want to make sure it's effective, and the best way to do that is to get feedback from how the program went yesterday.
And as the workshop continued, we actually got more and more questions. So towards the end of it, we were actually engaging with the men and women in the audience quite well. So that's the first step. They get them to talk about it, and then they'll start sharing the more difficult experiences, which in general men are reluctant to share. It's their own battle and they keep it to themselves. So I'm quite hopeful that just getting the conversation going out in the community will help men come forward, and particularly men who have survived cancer, because it's a great role model for people who are newly diagnosed to see that you can come out the other side and be fine.
And the women folk, what direct messages were given to them at the workshop yesterday? How can they help their men in their lives?
Well, because we focused on lifestyle, the first thing we talked about was actually diet. And so we talked about the fact that obesity is associated with common cancers like bowel cancer in men, and that it wasn't a dramatic change in diet. It was just to have a little bit more in the fresh fruit and vegetables and a lot less of processed food that's got a lot of sugar, fat and so on. So women have a role in how the meal's prepared, and so we think if they know that they've just got to make those changes and just bias the diet, because fresh fruit and vegetables are good for you. They've got a lot of fibre, they've got vitamins, they've got antioxidants, which are actually anti-cancer chemicals in them, and it's the best way of getting all of that. So we started there. we talked about things like exercise. And so not only setting out and going for a run and so on, but just in your normal daily, using the stairs instead of taking the elevator and all that sort of thing, can mean that you increase your exercise almost without knowing it, but it's a powerful force for good, again, in common cancers like bowel cancer. So we started off with messages for both. I think the other big message, of course, that you'd not be surprised at would be the smoking. And although we don't exactly know the smoking rates in Papua New Guinea, we know they're high, and women do have a role in trying to convince the men that this is a habit, although it can be hard to break, that would really make a significant difference to not only lung cancer risk, but a whole lot of other cancers, and in fact heart disease and lung disease.
Gentlemen, the use and the practice of chewing betel nut must have an impact on the level of mouth cancers in Papua New Guinea.
Yes, no, very true. It does. I think there's been numerous studies done on it. In Papua New Guinea, unfortunately, because we don't have a cancer registry that's been set up yet, we don't have the exact statistics or the data. This goes back to the work we do. It's very important that we, the foundation advocates, and we push that agenda, to ensure that we are given those appropriate numbers. So it gives us justification on why we are focusing our work on mouth cancer or on breast cancer or cervical cancer. Most of the data we collect right now are from our own baseline surveys, that we conduct when we're doing the programs, or we go through WHO, which is through GloboCan, and then the Institute of Medical Research, PNG IMR, has some data as well, but it's all isolated. We don't have a general idea of numbers, specific numbers for the disease. But it's very important that we do what we do. We advocate, because it's hopefully the appropriate people in authority can initiate something, and we can get those those systems in place, which allow us to or justify why we need to go this direction in which particular cancer.
Professor Olver, in Australia, I'm assuming there is a cancer registry. Could you just speak about how effective having those statistics are?
Oh, look, it's very effective, A, to know the extent of the problem, and B, when you put in measures like public health measures to prevent cancer, you can actually measure what you're doing by a decrease in the death rate. And what we have in Australia is each of the states and territories collects the data, and then they're pooled centrally to produce Australian data, which can be compared to the rest of the world, fed into the World Health Organization, so we can compare countries. But to know where to put your resources, you need to know how many cancers you've got. And then you need to know whether in your country the measures you take are really hitting home, and what the most important measures are. You can't do everything at once, so you've got to pick the important one. GloboCan that Dadi mentioned, for example, because it doesn't have Papua New Guinea data, it actually just estimates how much cancer there should be from the countries around it. Well, that really isn't quite good enough for putting in accurate government policy.
Yeah, I think yesterday, even at the workshop, Governor Powers came to officiate, and he encouraged such programs to move forward. He's also not a big fan of organizations sitting and waiting for policies and strategies before for the government mandate to happen before we move forward. There are certain areas that we can take that step forward, and then eventually come into fall in line with strategies and policies. So at this stage, what the work of the foundation is focused on, education and awareness. There's very limited information out there on cancer, and this is why we focus on that. So as Professor Ian mentioned, we're the statistics that we need, it puts us in line in areas of priority well, I guess in this case, we can just prioritize on education and awareness, but we pick out from the current data we have, the top 3 cancers in the country, which is breast, cervix, and mouth cancer.
So in fact, when we do a men's seminar, irrespective of policies and so on, we can actually tell the men what they can do for themselves. And you may not know that betel nut use is associated with cancers, and if you do know, you may not know why. So we go out and we say, look, the problem with betel nut is the betel nut and the lime and so on just chronically irritate the lining of your mouth, and it irritates, and many years later that causes the sort of changes in cells that become cancerous. So people can understand that. Once they understand it, they know why they have to change the use. And so if every individual takes control for themselves, that's the other way of dealing with the problem.
And of course, a large part of dealing with cancer is the effect that cancer has on families and the support system of people who are suffering from it.
That's correct. This year, I know we're moving away from the men's cancer focus, but one of our events this year, we had a presentation from someone who, not a cancer patient, but someone who's, I guess, in the family regarded as the main income earner, and they're affected as well. In Papua New Guinea, when an individual gets cancer, it doesn't just affect the mum and dad or the brothers and sisters, it affects the extended family and the relatives and colleagues and the community. So it's not taken lightly, and it's also the economic impact needs to be considered as well. I've spoken about this on numerous occasions. An example was with cervical cancer, and this is why we're going to prevention or even early diagnosis. A lady was diagnosed at stage 1 for cervical cancer. So the procedure, was going to cost about 5,000 kina, okay? So the longer she left it, I guess the staging then elevated to stage 3. So she then ended up flying to Manila to have the procedure done. That ended up costing 80,000 kina. So if you see the difference between stage 1 and stage 5, there is a financial burden there, and that's part of the reason why we do all this education awareness. Get it done. The prevention is very, very important.
What are the main messages in Movember for the men of Papua New Guinea?
Well, our main messages were the simple ones. So we talked about diet, we talked about exercise, we then talked about alcohol, because the more alcohol you drink, it used to be associated with liver cancer and head and neck cancer, but now we know it's associated with bowel cancer, a very strong association. So we talked about reducing alcohol. We talked about more recent information about processed meats and red meat. Not that you have to cut them out, but just reduce them a bit and have more white meats, because we know they're associated with cancer. Again, bowel cancer, but also others like pancreatic cancer. We of course talked about smoking. I mean, that's an all or none. I mean, it's hard to give up, but there's nothing you could do that would reduce your cancer risk more than to give up smoking. And it does, even if you try and you fail, you try and you fail, we know that the more times you try, eventually you're going to get over the line. So don't worry about falling off the wagon once you've stopped, if that happens. But by the time you've tried 4 or 5 times, eventually you'll be okay, and that's the best thing you can do. And then we talked about some of the rarer things. It's often thought that if you have sort of pigmented skin, you're not going to get skin cancer from the sun. Well, you are, it just takes a longer time. So if you work out in the sun all the time, a hat, even sunglasses for your eyes might be a good idea. And then there are some things you can protect yourself from at work and do it yourself. People, asbestos is a big one. There's still quite a lot of that around. Handle it very carefully, because the fibres get into your lung and can trigger off inflammation and then cancer. And things like chemicals like benzene and dyes in the industries, textile industries, as well as even diesel fuel, not just people who have diesel cars, but people who are working with diesel machinery day in, day out. And so if you're given something to protect yourself at work, like a respirator or clothing, for goodness sake, use it. It's there for a purpose. So we covered those major things that people could do. And then, of course, we encourage people to get more exercise during the day. And a lot of people get those messages and they say, well, how much? Well, now we can put a figure on it. You actually need about 40 minutes of what they call moderate to severe. In other words, to get you puffed, if you like. I used to say to get you sweating, but here that happens all the time. So to get you puffed, and it's only 40 minutes a day. You don't have to do it all at once. It can be done in little bits. But if you aim for about that, and most people could fit that in a day, it has an enormous impact for women on breast cancer, for men on bowel cancer and other cancers as well. These are simple things. If there was a pill that reduced cancer by 1/3, everyone would want shares in it. But you don't need a pill, you just need to change some of the things you do day by day.
And early diagnosis is important. For our men, are there areas or places that they can go for that?
Well, I think the one screening that isn't universal yet that men can do is probably in bowel cancer. When you get to the age of 50, if you have your bowel motions tested for blood every couple of years, that could detect bowel cancer early, or in fact little polyps before they become cancerous, and you can prevent getting bowel cancer altogether. So that would be the most positive thing. PSA testing for prostate's a little bit more of a problem because although it can be elevated, it doesn't tell us which ones are going to be just grumbling on in the background and never causing a problem, or actually rapidly progressing. So we actually need a slightly better test before we tell everyone to do it. But there are some men with strong family histories that might benefit again after they reach 50 of having a PSA test if they're worried about getting prostate cancer.
Okay. We've recently covered stories about heart conditions. That's also linked to lifestyle diseases and the way Papua New Guineans live. Does cancer discriminate with regards to age, and especially for men?
Well, cancer is more common as you get older, but with men there are cancers that can occur a lot earlier than that. And one of the best examples is testicular cancer, which actually occurs often in the 30s or even younger than that. And again, well, the message there is not that you have to self-examine, but you have to know what feels normal. And as soon as something doesn't, you report it. Now, many times what you report won't be cancer, but you get reassured if that's the case. But if it is, getting it early means that you can cure it with a small operation and you're home free. And so that's the thing about early detection. And obviously the other one that men will get is skin cancer. That can occur quite early as well, particularly if you're sun exposed. And again, if anything on your skin changes, starts to grow, bleed, gets itchy or whatever, go and see about it. If it's something else, it'll be treated. If it's cancer, again, you get it before it spreads. And that's the important message.
And the work of the Cancer Foundation towards the end of the year and looking towards next year, what can we expect?
Yeah, well, we've got, in fact, we're going to have that conversation with Professor Olver later on. Yes, well, we've had a very, very busy year. I think we've reached numerous milestones that we set out to achieve this year, in fact, above and beyond. So next year, there's a lot on our plate. Of course, we'll roll out the existing programs that we do, provincial programs. But on top of that, we're now going into schools. So we can discuss that at another time. But yeah, very excited about doing cancer programs for schools next year.
Professor, any final words from you?
Look, I think the work that the Cancer Foundation does, first in increasing awareness, and then providing the evidence for people that will convince them of what to do is really important, and I'm a great supporter of the New Guinea Cancer Foundation because they're actually starting to show success, and now that they've moved into men's cancers, that's a great step forward.
Professor Olver, Dadi, thank you very much for your time on Tok Piksa, and we should remember that it's Movember and not November this year, and we look forward to more proactive concepts coming from the Cancer Foundation for 2016. Thank you very much to you both for your time on Tok Piksa.
Thank you.